422 on the wait list for Muskoka Shores and 337 on the wait list for the Pines. Wait is too long for seniors and their families. I'm proud to be part of a government that is committed to modernizing and expanding our long-term care system. In November, I had the privilege of announcing the expansion and redevelopment of Fairburn in Huntsville. But it takes a long time to build new long-term care facilities. Many seniors would rather stay in their homes as long as possible. And while those seniors wait for a place in long-term care, too many of them end up in hospital, contributing to our challenges with hallway healthcare. As we all know, the pandemic has created unprecedented challenges for the long-term sector. I want to take a moment to thank our long-term care workers in Muskoka. They've done a great job of protecting our seniors from COVID. Despite the great job they've done, the pandemic has highlighted that we need to do our part to help people safely remain in their homes for as long as possible. However, without the support they need, some seniors are at risk of ending up in the hospital or in crisis. One way to ensure seniors get that support is through traditional community paramedicine programs. Paramedics use their training and expertise to support the healthcare needs of community members. These programs have shown that 911 calls and hospital visits can be reduced. That's why our government has implemented a 100% provincially funded long-term care focused community paramedicine program. We started with in five regions with pilot projects. Then in November, Muskoka was one of 29 regions invited to apply to participate in this program. Today, I'm pleased to announce that we are expanding this program to the District of Muskoka. This funding, $3.25 million, will be used to build upon Muskoka's existing community paramedicine program to provide additional and appropriate care for seniors in their own homes. This could include in-home testing, access to non-emergency support 24 hours a day, 7 days a week through remote monitoring. And I'm sure that Chair Klinck and Steve Clement and Chief McWilliam will be able to give more details about how they envision the program working here in Muskoka. The bottom line is this program will help more seniors stay safe in the comfort of their own homes in their own community longer. So very excited about this news, and I would like to invite District Chair John Klinck to tell you more about what this program will mean here in Muskoka. Chair Klinck.
Okay, well, thank you, Norm, and good afternoon, everyone. I hope this gathering finds you all well and you and your families holding up as the pandemic continues. Well, first of all, Norma, thank you. Thank you to not only you and of course the people behind the scenes and your staff. We'd like to thank you for your continued advocacy on behalf of not only Muskoka, but our good neighbors to the north in Parry Sound. So thank you for that. And I'd be remiss as well if I didn't extend our thanks to Premier Ford and Minister Fullerton for you know, what I see as an exciting validation of our Muskoka Paramedic Services professionalism and commitment to community well-being. This investment, I believe, is an important move that will help us meet a great need in the community, providing support to the seniors, as you mentioned, while they wait space in a long-term care facility. Many families in Muskoka will, I think, take comfort knowing that their loved ones will soon have more access to what they deserve, that being the highest quality care that we believe can be provided through the partnerships that will be provided through this community paramedicine program. So in addition, I'd like to echo your sentiments with respect to how very blessed we've been throughout Muskoka, throughout the pandemic, with respect to the conduct and professionalism of our long-term care workers, and to all the healthcare workers throughout Muskoka, in our hospitals and all other settings. So with that, it's my pleasure, Mr. Miller, to have with us the gentleman who really has his reins on the health services portfolio at the District of Muskoka, my pleasure to introduce Councillor Stephen Clement, who is indeed the chair of the District of Muskoka's Health Services Committee. Over to you, Mr. Chair.
Thank you, Chair Klinck, and thank you, MPP Miller. This is very exciting news. As you may know, this all started as a pilot project and very quickly became recognized as a very much needed addition to our healthcare in our community. Extending our Community Paramedicine Program will also help to reduce alternative level of care pressures in our hospitals that they currently face. By providing at-home support for seniors and others in the communities that have the difficult time of connecting to healthcare systems, and those that are at high risk of hospital admission or frequent hospital readmissions can remain home where they're safe and amongst their loved ones, and therefore waiting for the availability of long-term care setting. Through this coordinated and proactive approach, avoiding ambulance transports to local emergency departments and added strain on the paramedic services, as well as the local hospital system, will result in positive outcomes. I can say that it will free up admission beds, emergency beds, and save us money in the long run, and save, especially at this time, workload on our staff when they're busy doing other duties. Healthcare is changing in the province. And this is one of the changes. This will enhance and hone the skills of our paramedics. And I'd like to mention at this time that they're more than just a ride to the hospital. They're very highly trained professionals. They give care and treatment at the scene and en route to the hospital. This program will fall directly in line with all those principles. And at this point in time, I'd like to turn it over to the Chief of Muskoka Paramedic Services, Jeff McWilliam. Chief.
Thank you, Community Chair Clement. And as mentioned, I'm Jeff McWilliam, and I am the Chief of Muskoka Paramedic Services and Emergency Planning. And I'm just simply honored to be here today and proud to represent the paramedics of Muskoka. It is a privilege to lead such a great group of professionals. Mr. Miller, thank you, and thank you to Premier Ford and Minister Fullerton. I've had a smile on my face for the last little while since we received this announcement, and it's just such an amazing addition to our program that's here that I'm truly excited about. Chair Klinck, I would like to also thank you and all of District Council, in addition to Committee Chair Clement and all of Health Services, and in addition to our district senior leadership for the ongoing and unwavering support of this program. It's truly been appreciated and is felt right through our entire service. Just for a bit of context, I'd like to talk a little bit about the Community Paramedicine Program and the 3 phases in which Muskoka has. The first one is community referral by EMS, and what this is a program that enables all frontline paramedics during the course of the regular duties to identify patients that may benefit from support services beyond the natural 911 environment. So links them to different services that are available in our community. The second piece is community wellness clinics. So this is where our community paramedics go into seniors' buildings or congregate living settings, and they're able to put on clinics and assess blood pressures and talk to folks about their overall health and provide them with some education and assistance on how they could better manage themselves. It also could include influenza clinics or assessments related to COVID-19. And the third piece is the large piece in which we've represented a couple of times here through the comments, is our home visit program, which allows us to go into the homes of those most vulnerable and really work with them within their own environment to establish a really safe place for them to stay and work with them with their own individual healthcare plans. So this is the current funding that we have for our program is just a little over $64,000 of base funding. So adding this additional money in is absolutely incredible. And like I said, I'm absolutely proud to be going in this direction. So with this funding, we wanted to expand our program delivery in multiple ways. Now, it's certainly not limited to these, but we are looking at adding additional hours of proactive service delivery, as Mr. Miller indicated, up to and including 7 days a week of service. And there's an ability to communicate with our program 24 hours a day in the future. And this is in addition to the expanded scope through remote patient monitoring, which is just a fantastic program that we're able to have folks monitor their own health system, their own symptoms, and we can see them through a secure network at our establishment here and call them and have conversations about what we're seeing as well. Of course, all of this is not done in isolation. This isn't Muskoka Paramedics doing everything. We couldn't be moving in this direction, obviously, without the provincial government, the LHINs, our community health hubs, the Muskoka Algonquin Healthcare with the hospitals, home and community care, Canadian mental health, and largely the family health teams here in Muskoka, Algonquin, and Cottage Country have been absolutely fantastic to work with in helping us develop and refine our protocols. So how are we going to do all this? That's the question. So with that, we need to train some more community paramedics. We already have some in school that have just started, and we're looking to get some started right away with this. So really excited to get that going. And one last thing I'll mention is the Community Paramedic Program. You've heard of those in different communities across the province, and if you've seen one, you've seen one, albeit they're all a little bit the same. They're all different because we try to tailor exactly what is needed in the community, as opposed to just taking a one thing fits all sort of approach on it. We really try to work with our community partners and work as capacity enhancers in the system and not duplicate services that are already out there, rather complement those services that are out there. So I would be remiss if I didn't mention the current community paramedics that have been here and entered into this program really with not knowing a lot about it when we first started it many years ago and what they were getting into. They've really made it happen today. And if it wasn't for them to step up, lead, promote, and champion this program with their dedication and compassion and professionalism, I don't think we would be in the position that we are today. So again, on behalf of Muskoka Paramedic Services, I wish to thank all those previously mentioned partners, ministry, Mr. Miller, for bringing this to us, and look forward to the positive future expansion of this program. So with that, Mr. Miller, I shall turn it back over to you, sir.
Thank you, Chief McWilliam, and very good explanation of all the great work you're doing. And let me also thank the paramedics. I know back in the spring, testing was a huge thing, and the paramedics stepped in when nobody else seemed to be doing it and really helped out with that testing. So that was, as I can tell you from all the calls and emails and everything else I was getting at the time, was the #1 priority back then. So thank you for that. At this point, I think we're welcome to take questions from the media. I guess if you make yourself seen so I can see if you're waving your hand at me, then I can just do it that way. And anyone who would like a question or to ask a question, please just say if you can make yourself so I can see you. That would be one way I could take your question. Or just unmute and ask the question would be the other way. And, hi, Allison. How are you? Did you want to ask a question, Allison?
Hi, sorry, unmuted.
Okay.
Muskoka internet situation. Yes. Are you able to hear me?
Just barely. You're making a good demonstration that the internet's not that great, I would say. You're a bit frozen right now. Yeah. Well, I guess we'll have to take a phone call after, Allison. Yeah. Anybody else have a question they would like to ask? Okay. Sure. Allison, you said if you want to submit a question by chat, that would be great.
So Allison would like to ask, how many community paramedics will this fund?
I'll maybe pass that question over to Chief McWilliam to respond to. So how many community paramedicine medics will this fund? If you provide some information.
Thank you, Mr. Miller, and thanks for the question, Allison. The funding is based on staffing, so that would enable us to staff 2 community paramedics 12 hours a day, 7 days a week, all year. What it will do is allow us to train additional paramedics. Our pool right now consists of 4 community paramedics, and this money will allow us to train in addition 6 more community paramedics to add into our pool at this time. So really excited to be able to not only train, but expand the service and the program in Muskoka.
Very succinct answer. Thank you, Chief McWilliam. Any other questions? Yes, so if you have a question, you can either unmute yourself if your internet is working or put it in the chat. We'll give it a minute or two, and if you think of anything after the call, feel free to send us an email as well. Looks like the information was provided was detailed enough for the media. So thank you very much, Councillor Clement and Chair Klinck. And again, congratulations and thanks for all the great work you're doing, Chief McWilliam. It's very much appreciated. I know all Muskoka appreciates the great work you're doing. So thank you. And I guess we'll leave it there then.
Okay, thank you, Norm.
Hey, take care, everybody.
Thank you.
See ya.
Be well.